So we're supporting calls for a new alcohol strategy for Scotland because we really need to re-energise and refocus our efforts to reduce alcohol harm and reduce alcohol death. They're just causing such massive distress to our families and communities. So the priority for families is really to see more action on alcohol availability and marketing, as well as improvements to treatment and care and support for their loved ones. And we know that in the past, a lot of the policy focus has been around price, which is important, but for families, that's not the biggest issue. So for families, they're just seeing alcohol everywhere, no matter where they look. We now see alcohol served in bookshops, cinemas, at family fun days. There's really very few alcohol-free spaces for families and communities to enjoy. In terms of marketing, it's something that harms whole families, and it's been really difficult to see years of written commitments from the Scottish Government but very little action. And when families or their loved ones are looking for treatment or care or support, you would really hope that they could find what they need in the local community. But we know from multiple stories from particularly bereaved families, they've talked about so many missed opportunities to intervene when their loved ones have been looking for support, and the kinds of services they need are just not there. And we're also hearing about so much stigma and judgment and in fact ignorance about alcohol harm within these so-called helping services. So we know that the alcohol industry have got very loud voices when it comes to lobbying the government, and it was really difficult to see how the government just caved into the industry in relation to their alcohol marketing consultation, saying they'd listen to the concerns of industry and they'd go back and think again. And in that instance, nobody thought to speak to a single family member about their view or experience of marketing. So we know that family voices are definitely not being heard.